Introduction to Child Health. Child health encompasses the physical, mental, and social well-being of children from conception through adolescence. It is a broad field focusing on preventive care, disease management, and promoting optimal development. Understanding the unique physiological and psychological needs of children is paramount for effective healthcare delivery. This discipline recognizes that children are not merely small adults, but have distinct health requirements and vulnerabilities. Early intervention and comprehensive care are crucial for establishing a foundation for lifelong health. Public health initiatives and individual clinical practices both play vital roles in advancing child health outcomes globally. The scope of child health extends beyond medical treatment to include aspects like nutrition, sanitation, education, and protection from harm. It involves a multidisciplinary approach, often requiring collaboration among pediatricians, nurses, public health professionals, educators, and social workers. Addressing health disparities and ensuring equitable access to care are central tenets of modern child health efforts. The goal is to enable every child to reach their full potential, contributing to healthier societies. Continuous research and policy development are essential to adapt to evolving health challenges facing children worldwide. Growth and development milestones. Growth refers to the measurable physical changes that occur as a child matures, such as increases in height, weight, and head circumference. These parameters are routinely monitored using growth charts to assess a child's progress against established norms. Significant deviations from these charts can indicate underlying health issues requiring further investigation. Proper nutrition, adequate sleep, and a healthy environment are critical factors influencing a child's physical growth. Regular checkups allow healthcare providers to track these vital metrics and offer guidance to parents. Understanding typical growth patterns helps in identifying potential problems early. Development, conversely, involve the acquisition of new skills and abilities over time, encompassing motor, cognitive, language, and social-emotional domains. Developmental milestones are age-specific tasks that most children can do by a certain age, such as smiling, sitting up, walking, or speaking first words. These milestones are sequential, with each skill building upon previous ones. Delays in achieving these milestones can sometimes signal developmental disorders or other health concerns, necessitating early intervention services. Healthcare professionals use standardized screening tools to assess developmental progress and provide appropriate support or referrals. Encouraging play and interaction is vital for fostering healthy development. Common childhood illnesses. Children are susceptible to a range of common illnesses, many of which are viral and self-limiting, such as the common cold, flu, and stomach viruses. These conditions often present with symptoms like fever, cough, runny nose or vomiting, and diarrhea. While most can be managed at home with supportive care, it is crucial for parents and caregivers to recognize warning signs that indicate a need for medical attention. Dehydration, difficulty breathing, and persistent high fever are examples of symptoms that warrant immediate professional assessment. Understanding the typical course of these illnesses helps in providing appropriate care and preventing complications. Good hygiene practices are essential in reducing their spread. Other prevalent childhood conditions include ear infections, strep throat, and skin rashes like eczema or chickenpox. Bacterial infections, such as strep throat and some ear infections, often require antibiotic treatment, highlighting the importance of accurate diagnosis. Chronic conditions like asthma and allergies also commonly manifest in childhood, necessitating long-term management plans. Education on symptom recognition, appropriate home care, and when to seek medical advice empowers caregivers to effectively manage these illnesses. Regular vaccinations play a critical role in preventing many serious childhood diseases. Prompt and accurate diagnosis is key to effective treatment. Immunization schedules and importance. Immunization is a cornerstone of preventive child health, protecting children from numerous infectious diseases. Vaccines work by introducing a weakened or inactive form of a pathogen or its components to the immune system, allowing the body to develop immunity without experiencing the full illness. This process significantly reduces the incidence and severity of diseases like measles, mumps, rubella, polio, and diphtheria. Adhering to recommended immunization schedules is critical, as it ensures children receive protection at the most effective times in their development. These schedules are developed by national and international health organizations based on extensive scientific research and public health data. They are designed to provide optimal protection against vaccine-preventable diseases. The collective immunity achieved through high vaccination rates, known as herd immunity, protects not only vaccinated individuals, but also those who cannot be vaccinated due to age or medical conditions. This communal benefit underscores the public health importance of widespread immunization. Misinformation about vaccines can lead to decreased vaccination rates, resulting in outbreaks of preventable diseases, posing serious risks to vulnerable populations. Healthcare providers play a crucial role in educating parents about vaccine safety and efficacy, addressing concerns, and promoting adherence to schedules. Regular communication and clear information are vital for maintaining public trust and ensuring high immunization coverage. Global efforts continue to expand access to vaccines, especially in underserved regions. Nutrition for children. Optimal nutrition is fundamental for a child's healthy growth, development, and immune function. Adequate intake of macronutrients, carbohydrates, proteins, fats, and micronutrients, vitamins, minerals, is essential to support rapid physical and cognitive development. Nutritional deficiencies can lead to stunted growth, impaired cognitive function, and increased susceptibility to infections. Conversely, excessive intake of unhealthy foods can contribute to childhood obesity and related health problems. Establishing healthy eating habits early in life is crucial for long-term well-being. Parents and caregivers play a pivotal role in providing nutritious meals and fostering a positive relationship with food. Dietary guidelines for children emphasize a balanced intake of fruits, vegetables, whole grains, lean proteins, and healthy fats. Limiting processed foods, sugary drinks, and excessive saturated fats is equally important. Specific nutritional needs vary with age, activity level, and individual health conditions. For instance, iron is vital for toddlers, while calcium and vitamin D are crucial for bone development throughout childhood. Healthcare professionals often provide guidance on age-appropriate feeding practices and address concerns about picky eating or allergies. Promoting a diverse and nutrient-rich diet supports overall health and prevents chronic diseases later in life. Education on food preparation and portion control is also beneficial. Infant feeding practices. Infant feeding practices are critical for the healthy growth and development of newborns and young infants. Breastfeeding is widely recognized as the optimal method, providing essential nutrients, antibodies, and growth factors that protect against infections and chronic diseases. It fosters a unique bond between mother and child and offers health benefits for the mother as well. Exclusive breastfeeding is recommended for the first 6 months of life, followed by continued breastfeeding alongside complementary foods for up to 2 years or beyond. Support for breastfeeding mothers, including education and lactation consultation, is vital for successful initiation and continuation. For infants who cannot be breastfed or whose mothers choose not to, infant formula provides a safe and nutritious alternative. Formula is designed to mimic the nutritional composition of breast milk, though it lacks the immunological benefits. Proper preparation and storage of formula are paramount to prevent contamination and ensure infant safety. Introducing solid foods, known as complementary feeding, typically begins around 6 months of age when an infant shows signs of developmental readiness. This transition should be gradual, introducing a variety of nutrient-rich foods while monitoring for allergies. Healthcare providers offer guidance on appropriate feeding techniques, food choices, and recognizing signs of readiness for solids, ensuring a smooth and healthy transition for the infant. Adolescent health challenges. Adolescence is a critical period of rapid physical, cognitive, and psychosocial development, presenting unique health challenges. During this stage, individuals experience significant hormonal changes, growth spurts, and brain maturation. Mental health issues, such as anxiety, depression, and eating disorders, are increasingly prevalent among adolescents, often influenced by academic pressure, social media, and peer relationships. Substance abuse, including alcohol, tobacco, and illicit drugs, also poses substantial risks. Promoting resilience, coping skills, and access to mental health services are crucial for supporting adolescent well-being. Open communication with parents and trusted adults is vital. Sexual and reproductive health is another key area of concern, encompassing issues like contraception, sexually transmitted infections, STIs, and unintended pregnancies. Education on safe sexual practices and access to confidential health services are essential for preventing negative outcomes. Injury prevention, particularly related to sports, motor vehicle accidents, and violence, remains a significant focus. Encouraging healthy lifestyle choices, including balanced nutrition and regular physical activity, helps prevent chronic diseases later in life. Healthcare providers must adopt an adolescent-friendly approach, respecting privacy and fostering trust to address these sensitive issues effectively. Comprehensive health education programs are invaluable for empowering adolescents to make informed decisions about their health. Child safety and injury prevention. Child safety and injury prevention are paramount concerns in pediatric health, as injuries are a leading cause of morbidity and mortality in children. These injuries can range from minor cuts and bruises to severe trauma, often resulting from accidents in the home, school, or community. Common types of injuries include falls, burns, poisoning, drowning, and motor vehicle accidents. Implementing age-appropriate safety measures and educating caregivers are crucial for mitigating these risks. A proactive approach to identifying and eliminating hazards in a child's environment is essential. Prevention strategies must be tailored to different developmental stages. Effective injury prevention strategies involve a multifaceted approach, including environmental modifications, product safety regulations, and behavioral interventions. Examples include installing child-proof locks, using car seats correctly, supervising children near water, and teaching basic safety rules. Public health campaigns play a vital role in raising awareness about common hazards and promoting safe practices. Healthcare providers also contribute by counseling parents on injury prevention during routine checkups. The goal is to create safe environments where children can explore, learn, and grow without unnecessary risks. Continuous vigilance and adaptation of safety measures are necessary as children develop and their environments change. Mental health in children. Child mental health refers to the emotional, psychological, and social well-being of children. It is as crucial as physical health for overall development and functioning. Mental health conditions in children, such as anxiety disorders, depression, attention deficit hyperactivity disorder, ADHD, and autism spectrum disorder, ASD, can significantly impact their learning, behavior, and social interactions. Early recognition of symptoms and timely intervention are vital for improving long-term outcomes. These conditions are often influenced by a complex interplay of genetic, biological, environmental, and social factors. Creating supportive environments at home and school is fundamental for fostering positive mental health. Stigma surrounding mental health can prevent children and families from seeking necessary help. Healthcare providers, educators, and parents must work collaboratively to destigmatize mental health issues and promote open discussions. Treatment approaches often include psychotherapy, behavioral interventions, and, in some cases, medication, tailored to the child's specific needs. School-based mental health programs and community resources play an important role in providing accessible support. Promoting resilience, emotional regulation skills, and positive coping strategies helps children navigate life's challenges. Regular screenings for mental health concerns should be integrated into routine pediatric care to ensure early detection and intervention. Supporting children's mental health is an investment in their future well-being. Developmental disorders in children. Developmental disorders are a group of conditions that involve delays or impairments in the development of various skills, including motor, cognitive, language, and social emotional abilities. These disorders often manifest early in childhood and can have a significant impact on a child's functioning and participation in daily life. Common examples include autism spectrum disorder, ASD, attention deficit hyperactivity disorder, ADHD, intellectual disability, and specific learning disorders. The etiology of developmental disorders is complex, often involving a combination of genetic, neurological, and environmental factors. Early identification and diagnosis are crucial for initiating appropriate interventions. Intervention strategies for developmental disorders are typically multidisciplinary and individualized, aiming to support the child's unique strengths and challenges. These may include behavioral therapies, speech and language therapy, occupational therapy, and educational support. The goal is to enhance developmental progress, improve functional skills, and promote inclusion. Family involvement is paramount, as parents and caregivers play a central role in implementing strategies and advocating for their child's needs. Healthcare professionals, educators, and therapists collaborate to create comprehensive care plans. Ongoing research continues to improve understanding and treatment options for these conditions, emphasizing the importance of a supportive and adaptive environment for children with developmental disorders. Pediatric emergencies. Pediatric emergencies are acute, life-threatening conditions that require immediate medical attention in children. These can include severe respiratory distress, cardiac arrest, seizures, severe allergic reactions, poisoning, and major trauma. Recognizing the signs and symptoms of a pediatric emergency quickly is critical, as children can deteriorate rapidly. Unlike adults, children's physiological responses to illness and injury differ significantly, often requiring specialized assessment and management. Training in pediatric first aid and CPR is invaluable for parents and caregivers. Prompt action can significantly improve outcomes and save lives. Management of pediatric emergencies involves a systematic approach, often following the ABCDE assessment: airway, breathing, circulation, disability, exposure. Emergency medical services, EMS, and hospital emergency departments are equipped with specialized pediatric protocols and equipment. Healthcare providers must be proficient in pediatric resuscitation techniques and possess a deep understanding of age-specific drug dosages and interventions. Effective communication with parents or guardians during these stressful situations is also crucial. Prevention strategies, such as child-proofing homes and promoting safe driving practices, are equally important in reducing the incidence of pediatric emergencies. Continuous education and drills are essential for maintaining readiness to respond to these critical events. Chronic childhood conditions. Chronic childhood conditions are long-term health issues that can significantly impact a child's physical, emotional, and social well-being. These conditions, such as asthma, diabetes, cystic fibrosis, and congenital heart defects, require ongoing medical care and management. Unlike acute illnesses, chronic conditions often necessitate a multidisciplinary approach involving pediatricians, specialists, nurses, and therapists. The goal of management is to control symptoms, prevent complications, and enable the child to live as full and normal a life as possible. Early diagnosis and consistent adherence to treatment plans are crucial for optimal outcomes. These conditions often require significant adaptation from both the child and their family. Managing chronic conditions involves not only medical treatment, but also addressing the psychosocial aspects of living with a long-term illness. This includes supporting the child's emotional adjustment, facilitating school attendance, and promoting social integration. Education for families on disease management, medication administration, and recognizing signs of exacerbation is vital. Transitioning care from pediatric to adult services is another important consideration for adolescents with chronic conditions. Healthcare providers play a key role in coordinating care, advocating for the child's needs, and empowering families to manage these complex conditions effectively. Research continues to advance treatment options and improve the quality of life for children with chronic illnesses. Child abuse and neglect. Child abuse and neglect represent severe violations of a child's rights and well-being, encompassing physical, emotional, sexual abuse and neglect. These traumatic experiences can have profound and lasting negative impacts on a child's physical health, mental health, development, and social functioning. Recognizing the signs of abuse and neglect is a critical responsibility for all individuals, especially healthcare professionals, educators, and social workers. Indicators can be subtle and varied, including unexplained injuries, behavioral changes, developmental delays, or poor hygiene. Creating a safe environment where children feel empowered to speak out is paramount. Early detection and intervention are crucial for protecting children and mitigating long-term harm. Reporting suspected child abuse and neglect to appropriate authorities is a legal and ethical obligation in many jurisdictions. Healthcare providers play a vital role in documenting findings, providing medical care, and collaborating with child protective services. Support services for child victims and their families are essential for healing and recovery, including therapy, counseling, and safe housing. Prevention strategies focus on educating parents about positive parenting techniques, stress management, and community resources. Addressing underlying societal factors, such as poverty, substance abuse, and domestic violence, is also critical in preventing child maltreatment. A coordinated community response is necessary to protect vulnerable children and ensure their safety and well-being. Advocacy for policies that support families and children is also important. Environmental health for children. Environmental health for children focuses on protecting them from harmful exposures in their surroundings that can negatively impact their health and development. Children are particularly vulnerable to environmental hazards due to their developing organ systems, higher metabolic rates, and unique behaviors such as playing on the floor and putting objects in their mouths. Common environmental risks include air pollution, contaminated water, lead exposure, pesticides, and hazardous chemicals in household products. These exposures can lead to respiratory illnesses, developmental delays, neurological problems, and certain cancers. Creating safe and healthy environments is a critical aspect of pediatric care. Strategies for promoting environmental health involve identifying and mitigating sources of pollution and toxins in homes, schools, and communities. This includes advocating for cleaner air and water policies, educating families on safe product choices, and promoting lead testing and remediation. Healthcare providers play a crucial role in counseling parents on reducing environmental risks and recognizing symptoms of exposure. Collaboration between public health agencies, environmental protection organizations, and healthcare systems is essential for effective prevention. Ensuring access to green spaces and promoting sustainable practices also contribute to healthier environments for children. Protecting children from environmental hazards is an investment in their long-term health and the future of our planet. Global child health issues. Global child health addresses the health and well-being of children worldwide, recognizing significant disparities in health outcomes between different regions and socio-economic groups. Many low-income countries face a disproportionate burden of preventable diseases, malnutrition, and limited access to healthcare. Leading causes of child mortality globally include pneumonia, diarrhea, malaria, and complications from preterm birth and birth asphyxia. These issues are often exacerbated by poverty, lack of clean water and sanitation, inadequate nutrition, and insufficient healthcare infrastructure. Addressing these challenges requires a concerted global effort. International initiatives and organizations play a crucial role in improving global child health through vaccination campaigns, nutritional programs, maternal and child health services, and disease prevention efforts. Strategies include promoting breastfeeding, providing essential medicines, improving sanitation, and strengthening health systems. Education and empowerment of women are also vital, as they significantly impact child health outcomes. Sustainable Development Goals, SDGs, provide a framework for global efforts to reduce child mortality and improve child health equity. Collaborative research, policy development, and resource allocation are essential to achieve meaningful progress. The aim is to ensure every child, regardless of their birthplace, has the opportunity to thrive and reach their full potential. Role of family in child health. The family unit plays an indispensable role in shaping a child's health and well-being. Parents and primary caregivers are the first line of defense, responsible for providing a safe, nurturing, and stimulating environment. They make crucial decisions regarding nutrition, healthcare access, immunization, and education. The quality of family relationships, parental mental health, and socioeconomic stability significantly impact a child's developmental trajectory. A supportive family environment fosters emotional security, resilience, and healthy coping mechanisms. Understanding family dynamics is essential for healthcare providers to offer holistic care. Family-centered care is an approach that recognizes the family as the constant in a child's life and actively involves them in healthcare decisions. This collaborative model respects family values, beliefs, and cultural practices. Healthcare professionals empower families with information and resources, enabling them to be effective advocates for their children's health. Education on positive parenting strategies, stress management, and effective communication skills can strengthen family functioning. Addressing family challenges, such as domestic violence, substance abuse, or financial strain, is also critical, as these issues directly affect child health. Ultimately, a strong, supportive family foundation is paramount for a child's optimal physical, mental, and social development. Community resources can also bolster family support. Health promotion in schools. Schools are vital settings for promoting child health, reaching a large proportion of the child and adolescent population. Health promotion in schools involves implementing programs and policies that foster healthy behaviors and create supportive environments. This includes comprehensive health education curricula covering topics like nutrition, physical activity, hygiene, mental health, and substance abuse prevention. Schools can also provide opportunities for physical activity through recess, physical education classes, and extracurricular sports. A holistic approach recognizes the interconnectedness of academic success and student well-being. Healthy students are better learners, making school health programs essential. Beyond education, schools can contribute to health by ensuring access to nutritious meals through school lunch programs, promoting safe and clean facilities, and providing on-site health services like school nurses. Addressing bullying, fostering positive social interactions, and supporting mental health through counseling services are also critical components. Collaboration between school staff, parents, healthcare providers, and community organizations is key to developing effective and sustainable health promotion initiatives. Policies that support healthy food choices, restrict unhealthy marketing, and encourage active transport to school further reinforce positive health behaviors. By integrating health into the school environment, we empower children to make informed choices and develop lifelong healthy habits. Neonatal care essentials. Neonatal care focuses on the health and well-being of newborns from birth through the first 28 days of life, a period of rapid adjustment and vulnerability. Essential care practices include immediate drying and warming, skin-to-skin contact, kangaroo care, early initiation of breastfeeding, and cord care. Routine screenings, such as for congenital heart defects and metabolic disorders, are crucial for early detection and intervention. Monitoring vital signs, feeding patterns, and weight gain helps ensure healthy adaptation to extrauterine life. Healthcare providers educate new parents on infant feeding, safe sleep practices, and recognizing signs of illness. This critical period sets the foundation for lifelong health. For newborns requiring more intensive support, specialized neonatal intensive care units, NICUs, provide advanced medical interventions. These units care for premature infants, those with birth defects, or those experiencing complications during or after birth. NICU care involves highly specialized equipment and a multidisciplinary team of neonatologists, nurses, respiratory therapists, and other specialists. Family-centered care is paramount in the NICU. Supporting parents through a challenging time and involving them in their infant's care. Advances in neonatal medicine have significantly improved survival rates and outcomes for vulnerable newborns. Continuous monitoring and gentle handling are key to successful neonatal care, ensuring the best possible start in life for every infant. Respiratory conditions in children. Respiratory conditions are among the most common illnesses affecting children, ranging from mild infections to severe chronic diseases. Acute conditions include the common cold, bronchiolitis, and pneumonia, often caused by viruses. Symptoms can include cough, wheezing, shortness of breath, and fever. Young children, especially infants, are particularly vulnerable to severe respiratory infections due to their smaller airways and developing immune systems. Early recognition of respiratory distress, such as rapid breathing or retractions, is crucial for prompt medical intervention. Good hygiene and vaccination are key preventive measures. Environmental factors like secondhand smoke can exacerbate these conditions. Chronic respiratory conditions like asthma and cystic fibrosis require long-term management to control symptoms and prevent exacerbations. Asthma, characterized by airway inflammation and constriction, is a leading cause of school absenteeism and emergency visits. Management involves medication, allergen avoidance, and an action plan for acute attacks. Cystic fibrosis, a genetic disorder, affects mucus production, leading to recurrent lung infections and digestive problems. Treatment includes airway clearance techniques, antibiotics, and nutritional support. Healthcare providers educate families on disease management, medication adherence, and lifestyle modifications. Advances in treatment continue to improve the quality of life for children with chronic respiratory issues. Regular follow-up with specialists is essential. Gastrointestinal disorders in children. Gastrointestinal (GI) disorders are common in children, ranging from acute infections to chronic conditions that affect digestion and nutrient absorption. Acute GI issues often include gastroenteritis, stomach flu, characterized by vomiting and diarrhea, which can lead to dehydration, especially in infants. Other acute problems include constipation and abdominal pain. Proper hydration and electrolyte balance are critical in managing acute GI illnesses. Recognizing signs of dehydration and seeking timely medical attention are essential. Good hand hygiene and safe food preparation practices are key to preventing many infectious GI diseases. Dietary modifications often play a significant role in symptom management. Chronic GI conditions in children include gastroesophageal reflux disease, GERD, celiac disease, inflammatory bowel disease, IBD, and irritable bowel syndrome, IBS. These conditions can cause persistent symptoms like abdominal pain, chronic diarrhea, poor weight gain, and malabsorption. Diagnosis often involves a combination of clinical assessment, laboratory tests, and imaging. Management strategies are individualized and may include dietary changes, medication, and lifestyle modifications. Nutritional support is crucial for children with malabsorption to ensure adequate growth and development. Healthcare providers work closely with families to develop comprehensive care plans and provide education on managing these complex conditions. Ongoing research continues to improve diagnostic tools and treatment options for pediatric GI disorders. Renal and urinary tract issues. Renal and urinary tract issues in children encompass a range of conditions affecting the kidneys, bladder, and associated structures. Common problems include urinary tract infections, UTIs, vesico-urethral reflux, VUR, and congenital anomalies of the kidney and urinary tract, CAKUT. UTIs are particularly prevalent in young girls and uncircumcised boys, and if left untreated, can lead to kidney damage. Symptoms can be non-specific in infants, making diagnosis challenging. Early diagnosis and appropriate antibiotic treatment are crucial for preventing complications. Understanding normal urinary patterns and hygiene practices is important for prevention. Regular monitoring is often required for recurrent UTIs. More serious conditions include chronic kidney disease, CKD, and nephrotic syndrome, which can significantly impact a child's growth and overall health. CKD in children often results from congenital anomalies or genetic disorders and requires long-term management, including dietary modifications, medication, and sometimes dialysis or kidney transplantation. Nephrotic syndrome, characterized by excessive protein loss in urine, also requires specialized treatment to manage symptoms and prevent complications. Pediatric nephrologists specialize in diagnosing and treating these complex conditions. Family education on disease management, symptom recognition, and medication adherence is vital. Advances in pediatric nephrology continue to improve outcomes for children with renal and urinary tract disorders, emphasizing the need for specialized care. Cardiovascular health in children. Cardiovascular health in children encompasses the well-being of their heart and blood vessels, from congenital conditions to acquired diseases. Congenital heart defects, CHDs, are structural problems with the heart present at birth, ranging from mild to severe, and are the most common type of birth defect. Advances in pediatric cardiology and cardiac surgery have significantly improved outcomes for children with CHDs. Early detection, often through prenatal screening or newborn examination, is crucial for timely intervention. Regular monitoring and specialized care are essential for managing these complex conditions. Lifestyle factors also play a role in cardiovascular health. Acquired cardiovascular conditions, such as Kawasaki disease, rheumatic fever, and hypertension, can also affect children. Kawasaki disease is an inflammatory condition that can damage coronary arteries if not treated promptly. Rheumatic fever, a complication of untreated strep throat, can lead to permanent heart valve damage. Childhood obesity is a growing concern, contributing to increased risk of hypertension and early-onset atherosclerosis. Promoting healthy lifestyle choices, including a balanced diet and regular physical activity, is vital for preventing acquired cardiovascular diseases. Pediatric cardiologists provide specialized care, including diagnostic testing, medical management, and surgical interventions when necessary. Education on risk factors and preventive measures empowers families to protect their children's heart health. Endocrine disorders in children. Endocrine disorders in children involve imbalances in hormones produced by glands such as the thyroid, adrenal glands, pancreas, and pituitary gland. These hormones regulate crucial bodily functions, including growth, metabolism, and sexual development. Common pediatric endocrine conditions include type 1 diabetes mellitus, growth hormone deficiency, thyroid disorders, and precocious or delayed puberty. Early diagnosis and appropriate management are essential to prevent long-term complications and ensure optimal development. These conditions often require specialized care from pediatric endocrinologists. Understanding the complex interplay of hormones is key to effective treatment. Type 1 diabetes, an autoimmune condition where the pancreas produces little to no insulin, is a significant endocrine disorder in children, requiring lifelong insulin therapy, blood glucose monitoring, and dietary management. Growth hormone deficiency can lead to short stature if not treated with hormone replacement therapy. Thyroid disorders, such as hypothyroidism, can affect growth, development, and energy levels. Management strategies are highly individualized and involve medication, lifestyle modifications, and regular monitoring. Education for families on disease management, medication administration, and recognizing signs of complications is paramount. Healthcare providers support children and families in navigating the challenges of living with chronic endocrine conditions, promoting self-management skills as children grow. Research continues to advance treatment options and improve the quality of life for these children. Genetic disorders and screening. Genetic disorders in children are conditions caused by abnormalities in an individual's DNA, ranging from single gene mutations to chromosomal abnormalities. These disorders can affect various bodily systems and lead to a wide spectrum of health challenges, including developmental delays, physical disabilities, and chronic illnesses. Examples include Down syndrome, cystic fibrosis, sickle cell anemia, and Fragile X syndrome. Understanding the genetic basis of these conditions is crucial for accurate diagnosis, prognosis, and genetic counseling. Advances in genetic testing have significantly improved the ability to identify these disorders. Early diagnosis allows for timely interventions and support. Genetic screening plays a vital role in identifying individuals at risk or those affected by genetic disorders, often before symptoms appear. Newborn screening programs, for example, test for a panel of treatable genetic and metabolic conditions shortly after birth, enabling early intervention that can prevent severe complications. Prenatal screening and diagnostic testing can also identify genetic conditions during pregnancy. Genetic counseling provides families with information about inheritance patterns, risks, and available support services. Management strategies for genetic disorders are highly individualized, focusing on symptom management, supportive therapies, and improving quality of life. Research in gene therapy and personalized medicine offers promising future directions for treating many genetic conditions. Ethical considerations surrounding genetic testing and counseling are also important aspects of care. Ethical considerations in pediatrics. Ethical considerations in pediatrics are complex, often involving unique challenges due to the vulnerability of children and their limited capacity for autonomous decision-making. Key ethical principles include beneficence, acting in the child's best interest, non-maleficence, doing no harm, and justice, fair distribution of healthcare resources. The concept of best interest is central, as parents typically make decisions on behalf of their children, but healthcare providers also have an ethical obligation to advocate for the child. Balancing parental autonomy with the child's welfare can be challenging in certain situations. Respect for the developing autonomy of older children and adolescents is also crucial. Issues such as informed consent, refusal of treatment, end-of-life care, and participation in research raise significant ethical dilemmas in pediatric practice. For instance, while parents provide consent for treatment, older children and adolescents should be given the opportunity to assent or dissent, respecting their evolving capacity for decision-making. In cases of conflict between parents and healthcare providers regarding a child's best interest, ethics committees or legal intervention may be necessary. Protecting patient privacy and confidentiality, especially for adolescents, is another important ethical consideration. Healthcare professionals must navigate these sensitive issues with compassion, cultural sensitivity, and a commitment to upholding the child's rights and well-being. Continuous ethical reflection and education are vital for all pediatric practitioners. Future trends in child health. The field of child health is continuously evolving, driven by advancements in technology, research, and public health initiatives. Future trends are likely to include an increased focus on personalized medicine, utilizing genetic information to tailor treatments and preventive strategies for individual children. Telemedicine and digital health platforms will expand access to pediatric care, especially in remote or underserved areas, offering virtual consultations and remote monitoring. Wearable devices and smart technologies will empower parents and children to track health metrics and manage chronic conditions more effectively. These innovations promise to revolutionize how pediatric care is delivered and experienced. Another significant trend is the growing emphasis on preventive health and early intervention, with a focus on addressing social determinants of health. This includes initiatives to combat childhood obesity, promote mental well-being, and mitigate the impact of environmental factors. Advances in vaccine development will continue to protect children from emerging infectious diseases. Global health efforts will intensify to reduce health disparities and ensure equitable access to care for all children. Research into gene editing and regenerative medicine holds potential for treating currently incurable genetic disorders. The future of child health is poised for transformative changes, aiming to create a healthier and more equitable world for the next generation. Collaboration across disciplines will be key to realizing these advancements.